Hello and welcome everyone to today's webinar, Advancing Gender Equity in University Research Environments, presented by Our Watch. My name is Dan. I'm a Prevention Implementation Advisor within the Prevention in Universities team at Our Watch, and I'm delighted to be moderating this webinar today. We are thrilled to welcome you for the next 80 minutes as we dive into 3 distinct case studies examining how academic communities can embed prevention principles within research, practice, culture, and systems. I'd like to begin by acknowledging the traditional owners of the lands on which we meet today. For me in Ballarat, it is the Wadawurrung people. I pay my respects to their elders past and present and recognise the continuing connection that Aboriginal and Torres Strait Islander people have to land, culture, knowledge and language for over 65,000 years. This always was and always will be Aboriginal land. So today we will be discussing gender-based violence. We know that gender-based violence is widespread across our society and touches the lives of many people. It's completely normal to have a strong reaction to what we'll be talking through today. If you do need to reach out, here are some numbers for support on the screen. If you or someone you know is impacted by sexual assault, domestic or family violence, you can contact 1-800-RESPECT via phone. Alternatively, you can use their web chat, which is available 24 hours a day as well. Q-Life provides support to lesbian, gay, bisexual, transgender and intersex people. 13Yarn is available for Aboriginal and Torres Strait Islanders seeking support. You can contact Lifeline or the Australian Human Rights Commission as well. And if you're a man concerned about your mental health or use of anger or behaviour or attitudes relating to violence, you can reach out to the Men's Referral Service. Our fantastic digital support today is Carmela, and she has placed these details in the chat box. Carmela will also share the code of conduct for today's webinar. If you wish to access captions today, please select the closed captions button in the Zoom menu on your device. If you have any questions or require assistance, please use the chat function to send a message to our digital support person, Carmela. Today's session will also be recorded and distributed once published as well. We will hear today from 3 sets of presenters from across 3 Australian universities, and then we'll have time at the end of the presentations for some questions. So if you have a question, please use the Q&A function and indicate who the question is for, and we'll endeavour to read out as many as we can. Our Watch, for those who don't know, is a national not-for-profit organisation established in 2013 by the Victorian and Commonwealth governments and is a leader in preventing gender-based violence against women and their children in Australia. We work with businesses, governments, individuals and communities to drive long-term cultural change where people live, learn, work and play, including in the media, in workplaces, universities and TAFEs, and in sporting organisations. Our Watch supports prevention in universities by providing practical tools and resources to guide universities in promoting gender equality and preventing gender-based violence through a whole-of-institution approach. Our Watch aims to equip university staff and leaders and students with guidance on effective prevention, communication and program design to sustain long-term systemic change. We're also pleased to celebrate the historic news that the National Higher Education Code to prevent and respond to gender-based violence has now been enshrined in law. This achievement represents years of dedicated advocacy and expertise from researchers, staff, student leaders, survivor advocates, prevention specialists and sector advocates as well. And their commitment has laid the foundation for safer and more respectful learning and working environments for both students and staff. It is a major step forward for the university sector, and we look forward to working together to support implementation of the code and strengthen our collective efforts to prevent gender-based violence. So we have 3 incredible presentations today to explore elements of the research domain of Our Watch's Educating for Equality model. First up, presenting from the University of Sydney Graduate Research School of Safer Communities office is Kellie Maxwell and Professor Louise Sharpe. We'll then hear from Dr. Jessica Ison and Dr. Samantha Marshall from the Reducing Gender-Based Violence Research Group, or ReGen, at La Trobe University, finishing with a presentation from Professor Penny Jane Burke from the University of Newcastle. Penny is the Director of the Centre for Excellence and Equity in Higher Education and Global Innovation Chair of Equity. She's also the UNESCO Chair in Equity, Social Justice and Higher Education. Carmela has kindly dropped their extended bios into the chat if you would like to look at those. The session will be recorded, and I'd like to extend a very warm welcome to our wonderful presenters today, and thank you so much for being here. Presenters have also will provide their contact details on their slides today, so if you wish to follow up with them on their presentation, please feel free to use those details. Before we hear from our presenters, I would like to pass over to our Watchers University's lead, Georgia Killick, to provide some additional context about the research domain. Over to you, Georgia.
Thanks so much, Dan. Good afternoon, everybody. I'm Georgia Killick, University's lead here at Our Watch. The Educating for Equality model is a whole-of-university approach to preventing gender-based violence, and it's based on the national and international evidence base, including Change the Story, which is the national framework. The Educating for Equality model identifies 5 key areas of focus, referred to as the domains for universities to operate in. So we have student life, teaching and learning, workplace, research, and governance, business and operations. And in 2025, we've been running a webinar series on each of the domains, and so far we are up to research. The student life, teaching and learning, and workplace webinars are all available, and I believe the links have been dropped in the chat. But today's focus is research. This is a critical domain and one that I am fiercely fascinated by and drawn to. Research is critical for reflecting and shaping the systems we live and work in, and holds significant weight in our institutions, but also for broader society. We'll acknowledge research structures and conventions at times can unintentionally reproduce inequalities or even marginalise voices that most need to be heard. When we consider gender equality, inequality, and the prevention of violence, lived experience, diverse forms of knowledge are essential for driving meaningful change. In Educating for Equality, the research domain is framed as having the capacity for transformative practice. It's about asking the critical questions: who's included, whose voices are amplified, and what assumptions underpin our methods. It's about resisting the narrow and transactional approaches and adopting models grounded in equity, participation, and ethics of care. We know that the people doing research and the structures and norms in which they operate in universities can either reproduce or challenge inequalities. Building safe, respectful, and inclusive learning environments requires research that is co-designed, collaborative, and responsive to context. At the same time, researchers are being asked to navigate structural challenges, whether it's related to funding, institutional sustainability, or meeting the needs of industry and community partners. And in addition, considering how intersectional approaches are meaningfully embedded in their work. None of this is easy, but it is critical to creating equal, safe, and respectful research environments. As you would all know, research is not just about data. It's about so much more. It's about how knowledge is produced and analysed, whose perspectives are legitimised, and how these insights can be used to build safer, more inclusive, and more equitable communities. That is the opportunity of the research domain within Educating for Equality. It's my absolute pleasure to introduce our first presenters today from the University of Sydney Graduate Research School and Safer Communities Office, Kellie Maxwell and Professor Louise Sharpe. Over to you, team.
Thank you very much, Georgia. It's a real delight to be here today. This is a really important topic, and we're really pleased to be able to tell you a little bit about the development of our respectful research training for our HDR supervisors. So that's our higher degree by research supervisors. And one of the reasons that we decided to develop this was that this is a real area we think of need across the sector. Kellie, can we go to the first slide? Thanks. So we established a new graduate research school a few years ago, which I have the pleasure of leading. And one of the roles that I have in that is that I'm responsible for strategy and policy related to those higher degree by research students. We have between 4,500 and 5,000 students who are studying either a PhD or a Master of Philosophy. So these are students in research. And we have a list of registered and approved supervisors, about 4,000 supervisors. And we know that one of the big problems in research training is that our PhD students in particular appear to be amongst the most vulnerable students when it comes to complaints about bullying, sexual harassment, and sexual assault itself. Some of the large surveys that have been done across the sector suggest that roughly 10 to 15% of students, female PhD students, report that they have actually been sexually assaulted during their PhD, which are huge numbers and very disturbing. And we know from an excellent and very large study that came out of Sweden a few years ago, where they surveyed over 30,000 PhD students. And they asked about 13 questions about sexually inappropriate contact. And of the female PhD students that they asked, 59% of them had had at least one of those things happen to them. So this is a cohort where we started to think, we know that our academics are and have always been required to do some mandatory training to enter into our supervisor register. But what sort of mandatory training is the most important thing that we could be offering? Because these people are initially registered for 5 years and then they need to complete re-registration. So for our new supervisors, I thought about what was the most important thing. We can give them online modules to help them understand the policies, but what we really need to do is to make sure that all our students are safe as a number one priority. And so I went to the Safer Communities team, which Kellie is from, and she'll tell you a little bit about her team and the way that we co-designed this intervention or training together. Kellie.
Thanks, Louise. Yes, so I am from the Safer Communities Office at the University of Sydney. I'm the Preventative Education Coordinator there. So we're the first point of contact for both students and staff who may be experiencing any forms of sexual misconduct, domestic and family violence, bullying and harassment, and issues relating to modern slavery. So like a lot of universities, we're a case management and support service and help students navigate internal and external reporting options, and also help them to reduce any impacts on their academic studies from what they might have experienced. We also run a number of education and training modules and workshops, and we target specific cohorts, and one of those is the HDR supervisors. So I'll now share with you the process behind the development of the Respectful Supervisory Relationships training for HDR supervisors and how that came about through the collaboration of the Safer Communities Office and Professor Sharpe at the Graduate Research School, who approached us with a vision to really strengthen supervisor training, focusing on respectful supervisory relationships. So the timing couldn't have been more critical. As she said, that at the time we were reviewing those results from the 2021 National Student Safety Survey, and as a national results, they were quite concerning. As many of you will know, about 14% of postgraduate research students reported being sexually assaulted, and 22.3% reported being sexually harassed by a university staff member. So in June 2022, the Safer Communities Office met with Professor Sharpe and together built a plan on how to better equip those HDR supervisors with the knowledge around expectations of behaviour and how to support students who disclose experiences of sexual misconduct. Importantly, this work recognised the ethical responsibility that supervisors hold. So with more power in the supervisory relationship, it's their responsibility to really model respectful behaviour, maintain boundaries, and set clear expectations. So to design the workshop, we drew on the Australian Council of Graduate Researchers Respectful Research Training Package. And that package was built around the Universities Australia Principles for Respectful Supervisory Relationships. So it really was the goal to create a research culture that's respectful, clearly defined, and safe for all students. So in September 2022, we ran consultations with HDR staff and students, and this ensured the content really reflected the nuances of the University of Sydney context and that supervisors were connected to all of our local resources. So by November 2022, we were ready to pilot the first workshop. So we collected and carefully reviewed that participant feedback, and based on this, the program was refined. And from March 2023, the training became compulsory for HDR supervisors, all new HDR supervisors. So that really marked a significant shift towards embedding respect and safety within the supervisory culture at University of Sydney. So in terms of the workshop structure, it's co-facilitated by a member of the Safer Communities Office and a postgrad coordinator. So that really ensures that we have supervisors can have their academic related logistical questions answered, perhaps by somebody that they know. And then we have the Safer Communities Office staff in the workshops to provide a really different perspective on the experiences of students and staff when issues arise. Obviously, there's lots of benefits for having this method of delivery, but it really helps with acceptability and shows endorsement by more established and long-serving academics. So the package consists of 6 video scenarios that highlight unacceptable behaviour in the postgraduate research context, and they're accompanied by discussion questions aimed at both supervisors and students to reflect on behaviour in the context of supervisory relationships. So these are the scenarios. Some of you may be familiar with these. They all have an overarching theme of the importance of bystander intervention, the role of each supervisor has to play in creating a safe research space for students. So they cover gift giving, exploitation, grooming and professional boundaries, homophobia and balancing family obligations, sexual relationships between supervisors and their students, gender roles and sexism, and image-based abuse. I'll now hand back to Louise.
Thanks so much, Kellie. So we wanted to really evaluate these to ensure that they were effective in changing attitudes. So we asked things particularly around the issue that Kellie mentioned of bystander behaviour. We asked people how confident they were in identifying what was a supervisory dilemma before and after the training. And as you can see, although about 72% of the participants were confident that they could actually identify these beforehand, that got up to 92% afterwards. So we felt that that was an important shift. But actually, we were even more pleased to see that there was a really important and significant shift from those that felt that they were likely to intervene if they were witnessing a supervisory dilemma, and that increased by 20 percentage points after having the training. And we think this is important because while it is probably likely that there could always be people who would want to take advantage of students and they would be hard to change their behaviour, if we can stop the bystanders, then we can really intervene to ensure that our students can remain safe, even if we unfortunately do encounter somebody who does not have the best of intentions. Likewise, the confidence of intervening or reporting a supervisory dilemma increased from 66 to 88%. And the confidence in having a conversation with a colleague about something that they witnessed that might be a dilemma also increased by a similar margin. So we were really happy with the self-reported outcomes that we got from this training. We also found that the training was highly valued by those who did it. We asked people to rate their experience of whether or not the workshop was informative, relevant, interactive, and easy to understand. And as you see, out of 10, the ratings were surprisingly high for what we had mandated as a training for our supervisors to do, and about which they were not all feeling thrilled about having 3 hours of face-to-face training on top of their usual academic load. So we think that actually satisfaction ratings of 8.8 to 9.2 are really quite outstanding. And there are some quotes for you on this slide that I won't read through, but you can see that actually our supervisors find it a really great format, very informative and thought-provoking and well run. And just as somebody who's run some of these, I can tell you that there have been some really interesting things that I've noticed. One of which is that a lot of our young supervisors actually are really on board with this stuff. And we occasionally get new supervisors to the university who are experienced and come from elsewhere. And I remember in one of these trainings, a guy who was an associate professor coming in and explaining to the young people at his table who were just starting their supervisory career that actually, you know, he was very experienced, and it was only because of the foolish management at the university that he had to do this training because we required it for our new supervisors. And as some of the vignettes and videos played on, he then made a comment to the table during one of the small talk areas about how in his day it was perfectly acceptable to marry a PhD student. So it was kind of surprising that, you know, some of these boundaries were being called out. And what was fantastic actually about the group was that I didn't have to say a word because the young people at the table set him straight in no uncertain terms about how inappropriate that was. And I think that's part of what's so effective about these. And that's an important point to hold on to for our next step, I guess, Kellie. The other thing that we're really pleased about is that we've been reporting on our annual disclosures of sexual misconduct. And over the last 2 years, we've had an increase in HDR students seeking support from the Safer Communities Office. And we think it's a direct result of this training, and we're really pleased about that. Supervisors have reached out for support and told us that it's because of this workshop. And in fact, in the trainings that I've done today, I've had 3 members of staff come up to me and tell me that they had been sexually harassed or assaulted during their PhD, and were really delighted with the work that we had done. So we really are pleased with the fact that this has made a major change at our university in the culture around sexual harassment and bullying of PhD students. But the problem that we have is that the next step. So the problems that we have is we're coming up now for the fact that it will be 5 years since all of our supervisors joined our supervisor register, which was established on the 5th of February 2021. If we can move to the next slide, Kellie. So we have roughly 2,600 supervisors who are on the register who we need to provide some mandatory training for in order to allow them to continue their registration for another five years. And we were in a bit of, we weren't really sure how we were going to possibly do this, because clearly we run these in small groups of 20 to 30 academics with at least 2 presenters, as Kellie said, one from my team and one from hers. So how are we going to be able to scale this to 2,600 supervisors by February next year and sustain it as we re-register people who joined after that time? Because I was adamant that I want all current supervisors to be up to date with this essential content so that we really do try to ensure that PhD training at our institution is safe. So what we decided to do was to actually convert it to an online program. So you see some screenshots from the online program. And it really goes through all of the same kinds of, in fact, exactly the same kinds of videos. It's interactive. There are quizzes. There are times for people to have reflections in order to move on. They have to watch the video in order to be able to complete. And they also have to be able to sort things into piles for inappropriate versus appropriate behaviour. So let me just tell you a little bit about the reception of both the face-to-face and the online program that we're doing. So we haven't yet launched the online program. That's basically coming up, but in the policy, every supervisor at the university to stay registered will need to do that. We know that supervisors tell us that what they really like is the case-based format and the small group discussion. So I guess we're really going to evaluate this to see whether or not in the attempt to scale it up, we can get just as good benefits for our more senior staff who have been supervising for longer, but possibly, like the gentleman I told you about in the groups that we did, may have grown up, if you like, in a time when this sort of misbehaviour was much more common and, dare I say it, acceptable. We find that the groups work really well when people are a bit resistant. And as I said, we'd have multiple disclosures. But I think what's been really important for us is our Associate Deans of Research Education who lead HDR in each of our 8 faculties have been absolute champions for this program. They've really come on board with how important it is. And we've been able then to operate this train the trainer kind of thing where I have trained them with the Safer Communities group to actually co-facilitate these. And I think that's been really successful for the face-to-face component. And therefore, there's strong support for rolling this out as part of the registration in an online module. We haven't had any feedback on this yet because we're only just at the stage where people are looking at it and giving us feedback. But the first email that I got about it at all was this, where you can see this is from one of our associate deans who really thought that it was excellent and that we'd done a great job trying to get the right scenarios. And she's provided some feedback. And we hope that this is going to be an avalanche of positive feedback that we hear as we do go towards rolling it out. So in conclusion, I think what I would say is, I'm a clinical psychologist by training. When I read those results of the HDR cohort and how precarious their situation can be, I felt so strongly we needed to do something about it. This has been a great partnership between Safer Communities and the Graduate Research School. This is an effective program. It really is well received, and it is very positively regarded by our senior leadership. We're going to roll out the re-registration online, and we're going to try and ensure that we capture whether or not it is as effective in this format. And if it is not, we're going to really think about other ways that we could scale it out. There are some future initiatives that we're really thinking about. And one of them is really thinking about whether we can give some complementary training. One of the things that I hear from students who have been taken advantage of is that they really didn't understand where the boundaries were themselves. And so we have developed some pilot material for a complementary HDR training. We just need to work with the students to see how we could best, if you like, market that so that there was uptake, as our initial attempts didn't go as well as we hoped. And from, I saw a question that came up on my screen as I was talking, so I just end with say there has been an increase in the reporting from HDR students, and we do believe that it is a direct result of this program. So we are certainly really grateful to the Safer Communities Office for having led this program of work, and really pleased that we've been able to do it for the students.
Such a wonderful job. Kellie and Louise's contacts are there on the screen. Thank you so much, Kellie and Louise, and so incredible to hear about your work developing these workshops for HDR supervisors and the fantastic feedback you've received. Well done, and thank you again. I'll now throw to our second presenters for the session, Dr. Jess Ison and Dr. Sam Marshall from the Reducing Gender-Based Violence Research Group, or ReGen, at La Trobe University. Over to you both.
Thanks so much, Dan. My name's Dr. Sam Marshall. This is Dr. Jess Ison. Today we're going to talk to you about our project that's embedding a researcher in university to do sexual violence prevention work in our residences, and how that collaboration for sexual violence prevention.
We'd like to start by acknowledging that we're both coming to you today from the lands of the Wurundjeri people of the Kulin Nation, and pay our respects to elders past and present, and acknowledge that sovereignty has never been ceded. So we'll just give you a bit of a context about where we come from, ReGen, and the Prevention and Inclusion team, professional services team that we're working very closely with. A bit around the origins of the project, how it came to be and how it was set up, and then a bit more detail around what embedded research means and how we can use it to tackle intersectionality in our work.
So the Reducing Gender-Based Violence Group, or REGEN, is an interdisciplinary research group at La Trobe University. We come from a range of backgrounds, from public health and nursing to criminology and gender studies and social work and others. And we have a range of different expertise as well. One of our biggest projects right now is a sexual violence prevention project where we're evaluating 9 sexual violence prevention projects across Australia to see what works for sexual violence primary prevention. We also have broader gender-based violence research expertise, and one of our key focus areas is the prevention and reducing gender-based violence in institutional settings such as sports clubs. So, I mean, that's up to Sam. I've got none of the sports stuff. In public transport, in health-based settings, and of course in universities.
So this is really a partnership project. We're working very closely with the prevention and inclusion team, which is a professional services team, also known as Respect at La Trobe. Their work really focuses on building a culture of respect, equity, and safety at La Trobe University. They lead a number of initiatives. They have expert practitioners on a number of different topics, including sexual violence prevention, mental health promotion, advancing anti-racism, and a number of other inclusion initiatives. Their work primarily focuses on delivering training, running awareness campaigns, developing resources to create lasting change within the university. And they really prioritise collaborating across the university community to making sure that everyone feels safe and respected and valued. And I'd really just like to also acknowledge the work that a number of that team have done in setting up this project, particularly Dr. Kwong La, Rose Wimbush, Kellie Alexander, who did a lot of work before I came on board, and a lot of the work is sort of foundational to this project. So huge thanks to them as well, and acknowledgement of that.
So really the origin of the project is many years in the making. REGEN and the P&I team have been really building our relationship over a few different projects. We've worked together on evaluation. I've sat on some of their committees or some of the action plan committees, for example, and we've really just been in general often calling each other up and asking each other's help and advice and really building that relationship of trust and rapport. And so then we went to meet with them one day to just catch up, see what was happening, how we might collaborate. And they mentioned that they wanted to do a project where they were going to do an audit tool in the residences. And they were looking at going to an external consultant. At REGEN, at the time, we had I was leading some research on gender-based violence, or specifically sexual violence prevention in universities, but it was falling a little to the side in my busy schedule. But of course our ears picked up and we said, why don't we do that work instead of an external consultant? Firstly, because it is quite significantly cheaper. We think that we would do the work better because we know the university, we understand its ins and outs. And we also had someone in mind who would be excellent for the role. So a lot of things were falling in place. So we came to an agreement that it would be wonderful to work together to continue bridging that gap between research and the professional staff. And we looked at our respective pots of money to see what we could pull together. And that's always, of course, one of the issues that we're up against. We thankfully also had another project in mind that Sam would also be able to help on because we always want to ensure the most ethical employment practices for research staff to have full-time employment where possible. So we managed to get Sam on board for a few days on this project, and then she does work on some other projects, which is very exciting. And then since Sam's been here, we've also gone to the provost at La Trobe to talk to him about the research and other senior management to really keep it on the agenda, but also to ask for further funding for Sam. We have secured from the provost a second year of funding for the project, which is wonderful. So the program really came about from that relationship building and really because we knew that it would align with the university's priorities around sexual violence prevention, and in light of what was then likely to be a code introduced. And so we wanted to get ahead of that by working collaboratively across the two teams. The other thing is that we knew that so much of the research, it comes out of the US. Most of the people on the call won't be surprised about that. And a lot of it isn't particularly relevant to the Australian context. And even more than that, for a university like La Trobe, a working class university, a lot of the research isn't particularly relevant to us. So we also wanted to make a project that would be useful for our university, with also broader application to other universities in Australia, but really capture those specific nuances.
So that's sort of where I came into the picture. A lot of that groundwork had already been done, and there was also a Living at La Trobe working group, which not just the P&I and Regen, but also members of Safer Community from La Trobe, the manager of Uni Lodge, who manages the residences at Bundoora, student health and wellbeing, student outreach. So a huge network of people all sort of pulling in the same direction, which has really been invaluable in the success of this project. So once we sort of worked out where we were going, the next step was designing a tool. As Jess said, there wasn't really one that was fit for purpose to talk to students in residences and understand what the drivers and enablers of sexual violence in those settings were. So we leaned heavily on Our Watch's Educating for Equality model, and the drivers, one of which is research in our tool that we've developed, and also the self-assessment tool that's for staff from Our Watch, but we adapted that structure and obviously the content and the tone to make it more suitable for students. But that focus group sort of structure as well was really helpful for us. We, after some collaboration, we decided, because La Trobe is a very diverse university, it's got a lot of different residences across a lot of different campuses, and even within Bundoora there are 4 residences, all with very different cultures. We really wanted to understand what was happening within each of those residences. Was something working in one residence that wasn't working in another, or there was what particular thing that we could address in one that maybe wasn't as much of a priority in another. So we decided to do one focus group per residence, so each focus group will only have students from one residence, and really try and draw out those nuances and those drivers that are happening on each residence. So the next challenge that we faced was ethics approval. A lot of the researchers on the call will know that that's often a lengthy process, as it was with this. It was a new process for the P&I team, but I think it was really valuable in just getting on paper exactly what we wanted to do, how we're going to do recruitment, and go through all of that. Which brings us to student recruitment, which again is always a challenge, particularly in residential settings where students have a number of different priorities, and participating in focus groups possibly isn't one of those. But again, having those relationships that the P&I team and Regen had already developed across the university was really invaluable, and so everyone came together to help us recruit for that. And as Jess said, along the way, advocating for the project within the university to extend it into the future, and also just raising awareness, and I'll talk a bit about why that's important in a moment. This is just a quick infographic to show how spread out the campuses are. We want to make sure that we're capturing not just the metro residences, but also the regional and the more rural ones as well, and just talking to all the students, making it as intersectional as possible. So the aim of the overarching project was to understand how to better prevent sexual violence in La Trobe residences for all residential students. As part of that, sort of built into that overarching aim, there's 3 sort of sub-aims. Importantly, obviously, the co-production of knowledge with researchers and practitioners that will benefit La Trobe University specifically, and also align with the National Code, which, as Dan said, passed this week, which is just really awesome. We want to provide a really nuanced and context-specific evidence base for the P&I team and their ongoing work in this space, and then generate academic outputs to advance sexual violence prevention in the higher education field across Australia, and really fill some of those gaps that Jess mentioned. The key sort of challenge that we've been grappling with as we sort of work out what we're trying to achieve is, how do we make sure that this work is really intersectional? We know from the Combahee River Collective and Kimberly Crenshaw and others that an intersectional approach is one that makes visible the systems or the roots of oppression. We need to understand how privilege and oppression interact to make some people more vulnerable, and also some people face increased barriers to accessing support. Embedding an intersectional approach in this way, a truly intersectional approach, though, is a bit of a challenge in a university, which, as Colpitts shows us, is a neoliberal institution. They're ones that emphasise profitability and reputation and freedom of choice. And so often the programs that are funded or prioritised in a university setting are ones that are very easily visible, easily measurable, and they're sort of prioritised above ones that prioritise broader structural transformation, which is maybe longer term
and a bit harder to measure. The other thing that a neoliberal institution has a tendency to do is frame sexual violence as an interpersonal issue. So it places the emphasis on the individual and individual actions, where the university can say we have a zero tolerance approach, the perpetrator is sanctioned or even expelled, bystanders are upskilled so that it's their responsibility to act in the moment. And while those initiatives and prevention initiatives are really important, it removes the institutional element and the organisational responsibility from the university, which is actually where sexual violence is embedded. So we hear that universities often talk the talk about intersectionality in their policies and practices, but it may not actually result in truly intersectional practice, as we know as a whole, for sexual violence prevention for all students. The way that we've sort of grappled with this for this project is embedding a researcher. Embedded research sort of is one way to contend with inherent challenges of bringing an institution along on the process and working within and across the hierarchies of the university as we build those relationships and sort of sit within that team. So my role as an embedded researcher, I work very closely with the P&I team. I sit in their office, which is a great privilege, and have lots of meetings with different stakeholders. So it's really, rather than just coming in, performing some research and leaving, it's really sort of getting to the bottom of how it's being experienced. McGinty and Solikangas describe embedded research as a political act that we undertake to disrupt, destabilise and question the validity of assumptions that inform social mechanisms within our society. It allows researchers to get under the skin of these organisations and ask difficult questions, and grants access to see multiple perspectives as they traverse the hierarchies inevitable within such institutional apparatus. So you can understand how that sort of fits quite well in that call for intersectional work. There is precedence from other fields for embedded research, not less so in sexual violence prevention in universities. But what we know from places like healthcare, for example, having a researcher in a hospital, is that it really, the knowledge co-created on the ground really provides better insights into the issues affecting, in this case, practitioners and our students. And it can be more relevant to the local context and also is more easily incorporated into policy changes. And we really want to acknowledge that a lot of universities have established working groups that includes researchers and professional or practitioner staff, which is really important, but we're sort of formalising that process through the role and research outputs and things like that, which is, just really embedding that research. So this is a bit of a summary of the project. We've talked about some of those challenges, but I think the benefits of embedding a researcher are really clear. It really responds to that intersectional work that we really want to do. And our future goals is that really in the reports to the university is an interrogation of those power dynamics and how they may be facilitating sexual violence in universities and in residences. We'll use the recommendations to develop the next action plan for Trobe. And we'll also deliver future audits against the baseline that we've done from this audit to measure how we're improving, as well as sort of evaluation. And then obviously some academic and practitioner focused outputs as well. So thank you so much for your time.
Wow, thank you so much, Jess and Sam. Absolutely brilliant to get an understanding of the embedded researcher model and those local knowledge production benefits to prevention efforts, and the way you've weaved intersectionality into the work as well, despite the many challenges. We love to see it. And a reminder that we'll be accepting questions for all of our panelists, presenters, I should say, today. So do make use of the Q&A function if you're looking to follow up with any of these approaches that we've heard today. Before we get there, though, we will hear from the wonderful Professor Penny Jane Burke, the University of Newcastle's UNESCO Chair in Equity, Social Justice and Higher Education. Over to you, Penny.
Thank you very much for the invitation to participate in today's really important discussion and webinar. And it's a particular joy for me because research for equity is a lifelong passion. This first emerged when I accessed higher education through an alternative pathway program 35 years ago after escaping domestic violence with my baby son. During my student experiences all those years ago, I was struck by the many students like me who had accessed higher education against all odds as they continued to navigate intersecting inequalities. These experiences formed key insights and led to my life's work, including to open time, space, and resources through research to generate the conditions for equity and social justice. And this is the focus of my presentation today. So I will consider why we need to treble research conventions, introduce the multidimensional social justice research frameworks we've developed in the Center of Excellence for Equity in Higher Education, and share a case study of our research to illuminate the points I'm trying to make. So in an age in which evidence is seen as core to the development of policy and practice, it is crucial to consider the methodologies by which knowledge and evidence is produced. We must ask key questions of our research practices, such as who determines what counts as knowledge, what happens when research conventions become ingrained, institutionalized value orders, how is privilege and disadvantage produced or reproduced through dominant research conventions, and who is subjected to the powerful gaze of research. And without critical questioning, we are at risk of further ingraining deficit and stigmatization into the design and conduct of our research. Deficit has long been part of the way equity is imagined in higher education, something we're all very familiar with now. The problem of equity is often seen as in the bodies of individuals facing disadvantage. The starting point is thus flawed. The problem tends to be set up through a distorted lens of the perceived deficiencies of individuals. The distortion is in the individualization of what is a social problem. The social problem is thus misrepresented as individual lack of a range of attributes: aspiration, potential, confidence, resilience, motivation, time management, and on and on. Deficit embeds itself in equity structures and practices, and thus can become a major obstacle for generating knowledge towards creating systemic change socially, culturally, and institutionally. In research funded by the federal government, we undertook a systematic and rigorous review of international research of equity in higher education. Our research uncovered that even when research was attempting to challenge deficit, a perspective of deficit was regularly recuperated. This was related to a trend in which there was limited consideration of methodological concerns, with a leap towards methods of data collection. Deficit frameworks compel us into methods of measurement without careful consideration of the methodologies framing the way the research problem is being constructed. Simply put, very often, if it can't be measured, it doesn't count. The problem of equity is regularly constructed in relation to that which is deemed to be measurable, but this preoccupation with measurement conceals from view the insidious trauma of lived and embodied experiences of injustice, inequity, oppression, and violence. This is deeply harmful in so many ways. We need to shift attention away from perceived individual deficiencies and towards the multidimensional intersecting inequities that sustain relations of privilege and disadvantage in the name often of equity. So this led us to the development of a multidimensional framework consisting of 5 intersecting social justice principles. The principle of redistribution addresses socioeconomic forms of inequity. This involves the redistribution of quality resources, services, supports, and opportunities to enable meaningful participation. The principle of recognition addresses cultural forms of inequity by challenging the stigmatization of deficit frameworks through valuing participants' experiences, knowledges, and insights in processes of knowledge co-creation. And the principle of representation addresses political forms of inequity through the ethical representation of the problem of inequity and gender-based violence, including in responding to the voices of those most impacted by the research. The principle of methodological rigor considers how knowledge is produced, how data are interpreted, how power dynamics shape research processes, and how a strong ethics of care can frame the decisions we make as researchers towards the flourishing and well-being of participants and their communities. Drawing on this multidimensional framework, we have developed a research approach which we call POEMS, which is guided by a commitment to praxis to open time, space, and resources for collaborative, meaningful, and transformative dialogue across critical reflection, critical action. A pedagogical reorientation in which research becomes a space of learning with and co-creating knowledge with research participants. A commitment to sustaining an ethics of care with particular sensitivity to those who might be most impacted by our research. And methodologies that foreground the social context shaping participants' experiences, and with a deep understanding that context, values, and experience matter in the co-production of knowledge. Such methodologies enable more careful attention to power in research relations and processes, with a commitment to the co-creation of knowledge enabled through participatory thinking and practice. And I say thinking here because to do participation ethically, we need to think carefully about what participation means. I draw on Nancy Fraser's concept of parity of participation, which she explains is not about numbers, but is a qualitative condition. It is being treated as an equal peer and deeply responsive to and caring of the lives and the context of our participants. I will now share an example of research framed by the poems approach, which forms a key part of the UNESCO chair. The research explores how gender-based violence in all forms across the life course impacts higher education access and participation. Through engaging with 430 students through a survey, in-depth interviews, and ongoing arts-based workshops open to all participants, the research enabled a dynamic process where participants could reflect on their experiences in a mutually supportive environment. Students contributed to the research in a way that recognized their expertise in their own experiences. This we conceptualize as a form of trauma-informed agency, recognizing the contributions of student victim survivors to the research as catalysts for change. Our commitment to exercising an ongoing ethics of care directed how we approach the research design, data collection processes, data analyses, dissemination, and ongoing research as advocacy. The interviews helped us to understand the rich contextual details of participants' experiences, and the survey complemented this by gathering quantitative data on the prevalence and characteristics of gender-based violence, while allowing space for participants to share their personal narratives through open-ended questions. This combination ensured that the research was contextually rich and humanizing, and many of our participants expressed their sense of feeling valued, connected, and heard through the research. Importantly, this often brought new insight emerging from their participation that they were not alone in their experiences. It became clear as we developed the research, not only that the prevalence of experiences of gender-based violence across the life course was deeply harmful to students, but also that this harm is further exacerbated by the way that gender-based violence is regularly ignored, silenced, and misrepresented in higher education contexts. When gender-based violence is acknowledged as a student welfare issue at all, it is conceived of as a peripheral, one-off, and isolated incident, rather than the endemic social problem that it is. Participants reveal how gender-based violence intersects with financial deprivation to produce significant forms of educational disadvantage. While gender-based violence affects people across the socioeconomic spectrum, it also creates the conditions for financial deprivation and compounds pre-existing socioeconomic disadvantage. Indeed, gender-based violence can thrust victim survivors into homelessness, poverty, and crisis, regardless of their previous socioeconomic status. Research suggests that higher education has transformative potential for victim survivors, pointing to raised self-confidence, self-esteem, and self-sufficiency. However, transformation is largely understood in individualized terms, exacerbating deficit discourses by placing the burden on individual students to overcome gender-based violence experiences by changing their self-concept. The focus on self-transformation as the key concern ignores that gender-based violence is a social problem entrenched in social institutions, relations, and contexts. The invisibility of the social problem of gender-based violence creates the conditions for students to feel out of place, isolated, alone, shamed, and unworthy. This is not imposter syndrome requiring an equity intervention to fix lack of confidence. This is the effect of misrecognition on a sense of personhood and belonging, which requires a completely different approach to understand and then challenge gender-based violence as a social justice problem. As Loveday asks, how is it that a problem of society can so easily be turned into a deficiency of the self? Despite the high value the student participants placed on their studies, including in building capacity to advocate for and support others, a strong sensibility of not belonging, unworthiness, and shame emerged across their accounts. What is often missing from research and practice are the social justice approaches that might contextualize personal experiences of gender-based violence in broader social, cultural, and political unequal relations. Further, such approaches might mobilize analyses of lived experiences as a resource for collective advocacy, agency, and action. Our research created a space in which many of the students wanted to participate in broader collective projects of transformation and change agents. And I apologize, I would have loved to have stopped to read all of the quotes of the participants here, but we will circulate this so you have more of a chance to engage with what the students have said. The students' accounts emerging from both the survey and the in-depth interview data, when brought together in a social justice analyses, has led to over 30 significant recommendations to researchers, leaders, activists, educators, policymakers, and practitioners. This page is from our project website, and each of the 4 overarching recommendations on the screen here carries a number of more detailed ones. So we will circulate that after the event. The point that I want to make right now, though, is that when research opens participatory spaces, we can work together to ethically represent the issues and think together to identify the actions that can help create the change that is needed. One of the changes that arose from the recommendations from students was the establishment of a gender justice hub that could sustain engagement with student and community partners. The Gender Justice Hub is a visionary and long-term project that aims to contribute to mobilizing higher education for gender justice in the fight against gender-based violence. The Hub's vision is to build knowledge, capacity, expertise, and skills to activate higher education's contribution to long-term cultural transformation towards eradicating gender-based violence. Research in the Hub is conceived of as a form of advocacy by bringing the voices of participants together to generate collective advocacy, agency, and action. So to conclude, a key argument of my presentation is that research practice matters. We must always engage in critical questioning because research is not outside of, but is always situated within power dynamics. When research conventions are left uninterrogated, we can unwittingly reproduce inequities through our research practices, which includes the harm of perpetuating deficit and stigmatization. We really need time, space, and resources to build equity capacity, knowledge, and skills, and research approaches that do all of these when embedded in clear social justice principles has an important role to play in transformation for equity. Methodological rigor, parity of participation, and an ethics of care can help to challenge the persistent socioeconomic, cultural, and political inequities that uphold gender injustice and its manifestation in gender-based violence. When we reframe research through multidimensional social justice principles, we can open space for participants to bring new knowledge, experience, and insight to support equity, gender justice, and the collective struggle against gender-based violence. Thank you so much for listening. And I'd like to acknowledge as well the many students who generously participated in the study and shared their stories and insights, as well as the team members who are a crucial part of the research and the Gender Justice Hub. The beautiful artwork on the slides that you saw has emerged from our arts-based programs, Reclaiming My Place. And if you want to contact me for further information, please do engage with us. The email address is there. Thank you very much.
Thank you for that brilliant presentation, Penny. A really, really informative analysis of equity in research and the impact of educational participation as well. So really excellent work. We're thrilled now to welcome back all of our presenters and give the audience the opportunity to ask your questions. We've got just under 15 minutes to get through as many as we can. I will start with Louise, if I can. A question that's come through from the chat is, in a roundabout way, were there any kind of considerations around staff contracts, including gender-based violence in those and professional boundaries, and then looking at the consistency and the quality of trainers as well in the programs that you deliver?
Yeah, sure. Well, to start with, I mean, all of our staff are bound by a code of conduct already. And so whilst there aren't individual student contracts for those staff, they are expected and, you know, to abide by the code of conduct. And they do sign to say that they will do so. So I guess we didn't think that necessarily adding another thing that they signed to say that they would behave well was probably going to solve this problem. So that's why we didn't go in that direction. The second thing in terms of the trainers, so we have a relatively small number of trainers. So I think there are probably about 3 or 4 different people from Kellie's team that provide the training. And likewise, we trained up very senior academic staff who work in a higher degree by research. So, you know, I have been the facilitator on these. Some of my associate deans and some of what we call the research education academic directors have come in to run those as well. So these are people who are kind of you know, in our very big faculty of medicine and health, which is about half our university, those are the people that actually deal directly face-to-face with the students when they're in difficulty. So very experienced staff and a very small number who we trained up so that they had to do the training themselves. They were then trained to do the training, and then they come in and do the training and again get feedback from the co-facilitator, and they're always paired with somebody who's very experienced in delivering the program, and that's how we've kept the standard high of that program.
Wonderful. Thank you, Louise. As we're waiting for some more questions to come in, don't be scared. There's the Q&A button at the bottom there, or you're also welcome to pop it in the chat. I am monitoring that as well. I might throw to you, Penny, if I can, off the back of that wonderful presentation. Based on your experience, what advice would you offer for securing senior leadership support and buy-in to advance research that adopts that transformative approach and some of those recommendations that you were going through?
Oh, thank you, Dan. I think that it is a long-term project. So, you know, it's about, I think, continuously advocating for the value of working in these kinds of ways, and these kinds of ways that is underpinned by social justice, to be able to explain, clarify, and I guess to some extent convince people of the importance of working differently through our research if we are really committed to the values of equity and towards, now with the national code, I think that also goes a long way to supporting all of the kinds of work that we've talked about here. And it's so wonderful to be amongst this group and to hear about the incredible work that's being done. But we definitely, I think these policies and the legislation supports this kind of work. But I think demonstrating that through these kinds of ways of working, we can actually develop strategies and practices, inclusive practices that are co-designed and co-developed with our students and with our community partners. How much more valuable can the work be than that if we are genuinely, as an institution, committed to advancing equity? We've also used these kinds of approaches in a variety of different ways. So we've tried to use those social justice principles of redistributions to redistribute research opportunities to others through programs of providing grants, for example, institutionally for team-based research around equity in different disciplinary contexts, and then coming back together and building interdisciplinary understanding of equity through that work. And we've also done that on a more national basis as well, working with equity practitioners, for example, in those kinds of ways. And I think that in doing those things, you can demonstrate the value over time of these approaches. We call that constellations of impact in CIHI, where you can start to see that those approaches start to sort of trickle through other institutions and building more understanding, more advanced understanding of equity across the sector to really create the kind of sustained transformation that I think as a nation we're striving to achieve. So I would say, there's highs and lows. It's not always, fully understood, but I think that where you can continuously advocate, as I said repeatedly, I think it's about collective forms of advocacy and not being an individual on your own. So as much as we can support each other around the value of these kinds of approaches, I think is really important. But also finding leaders who understand the value of that, who can also join that collective advocacy for research that, understanding that research itself needs to be framed by equitable social justice principles.
Thank you so much, Penny. A question for Jess and Sam now. Your project draws on research expertise available within La Trobe to inform the prevention work that you do. How do you balance producing research that is highly contextualized to La Trobe with generating insights that might be relevant to the wider higher education sector?
Thanks, Dan. That's a great question. Obviously, part of the whole point of our research is that it's very context specific for La Trobe, but in that we're also developing up a tool that we'll publish on. So hopefully that can be used in other contexts and develop that sort of theory around the embedded researcher. So it's the ways of working, I think, are really valuable to share with other researchers across the sector. And then the findings that we get from our report, while that might be interesting as well, it's also really highly relevant and context specific to senior leadership in developing their policies and plans, as well as the prevention inclusion team and the wider team working in this space at the university. But it is a balance. And so I think we need to just make sure that we're prioritising both equally, as it is a partnership. Do you have anything to add, Jess?
Just to reiterate that I think the role is really unique and a lot of universities don't have this, but we're research institutions, but our researchers often aren't doing the research. And so some of the more conceptual outputs that Sam's working on will really give others some guidance on how they can do some similar roles, and hopefully we can see a bit of a shift where universities are using academics from their own university, or also other universities in collaboration too. It doesn't have to only be in-house, but doing that more collaborative work to bridge those divides, I think is really exciting, what we're really excited about. And so we really want to make sure that we put out some publications and other practice papers so that others can learn from that as well. So we're really conscious of wanting to share that across with other universities.
Excellent, thank you. A question for Penny that's come through, someone who's working in the Safer Communities team. What is the best response that they can give to staff who say that someone experiencing domestic violence might not be suitable or have capacity to complete studies right now and should consider dropping out? The question asker wants them to understand that higher education is a stepping stone towards financial independence from their perpetrator, and we need a different approach than just meeting the requirements of the course.
What a fantastic question. Thank you so much for that. Because I wasn't able to really dig into like all of the different themes that emerged, and one of them is definitely about temporal inequities and the huge impact, not just in terms of the financial aspects that I was briefly able to touch on, but also in terms of delayed study and sometimes attrition. Some of our participants took a very long time to complete their studies because of everything that they were dealing with in their lives that was largely invisible, because there wasn't a space to really articulate what they were going through. But at the same time as well, we shouldn't rely on individual disclosure. In my view, this is where the collective advocacy comes in. So I think, the more that we have research that can raise these kinds of issues and understand that the time frames and the rhythms of higher education are not inclusive for students who are, confronted by so many of our students, because we know that this is such a prevalent issue, that are confronted by these kinds of issues, and it disrupts their studies. So, I think that maybe having a discussion with somebody who's talking to you about it, but I think on a broader level, I think, you talk about embedded research. We talk about embedded research as well, and we talk about embedded professional learning. And I see these forms of research as a form of embedded professional learning, but we need to also not just have one-off training. I think we need to have ongoing spaces where people can engage with these kinds of dilemmas and issues that they're facing, and also have the support to raise them institutionally, so that people who are making decisions about the time and the rhythm of higher education study can better understand its negative impact on exacerbating inequities that already exist. So we have some time to go, but I think that we can use our own autonomy within our particular courses, or where our work lies, to try the best to navigate those things on behalf of students who are facing these. But we need broader advocacy to raise this institutionally and sector-wide, so that it's not up to individuals to have to disclose and point these things out.
Dan, can I just jump in to add to what Penny's saying? I really like the focus on the structural. I think one of the really key overlooked issues in this conversation is a vast majority of tutors are highly casualised, overworked, and often teaching many classes. I know for myself, when I was a tutor, I'd have disclosures and I simply would have to run to the next class I was teaching back to back. I might not know the student's name to follow up with them later. You are so overburdened and overrun. So I think one of the key issues for shifting how we see our students is actually changing the moving away from casualisation and highly overworked tutors, because they just are facing the burden on so many fronts, including having disclosures which they have no support for, no training in. Even if they have training, they're not paid to do it. And so it's placing what is a structural issue onto individual overworked tutors. So always front and centre when we're talking about universities, we need to be talking about casualisation.
Thank you so much, Jess and Penny. Kellie, I'd just like to throw to you, if I can, just quickly before we wrap up. We didn't want you to be sitting there without contributing, but I do have a question. How, in your role, do you, and in the project that you've discussed, overcome, and I know you said that there wasn't much, but any resistance or challenges from supervisors who you know, may be reluctant to participate in a training on gender equality?
Yeah, I think, as you said, we haven't had much resistance from that. I think we haven't experienced it in the workshops. There may be some people sitting there that may have come in there with some preconceptions as to what the experience will be like. And there have been people who have come up at the end of the workshop and sort of said, look, I didn't expect it to be the way that it was, and I actually did learn something. I learned something about my own experience as a HDR student, and that perhaps what I have learned in terms of the behaviour that was, in the old days acceptable is no longer acceptable. So I think it was, if they have come in there with, I guess, some resistance, they're generally walking out with a new idea of what is expected and the behaviours that they would wish to carry forward to their students, so that they're not feeling uncomfortable in any way and being more reflective of the experience they're giving their students. So yeah, I think that's probably what I could add there. I don't know if Louise has anything else to add on that.
Yeah, no, I agree. I think there are a range of issues amongst more experienced supervisors. I mean, norms have really changed in the time that I've been an academic. I've been an academic since 1997, and, you know, we wouldn't have thought twice about actually having a gathering of students at our homes, for example. That would have been a very normal thing to do in the 90s. And nowadays, you really need to be thoughtful and careful about doing that. An example that I often give is when one of my children was born, I was on parental leave. I used to have my students come to my house while I was feeding my children, because that was the way that I could accomplish my job whilst, being on parental leave and not let them down. And these days, I think that wouldn't be acceptable anymore. So I think there are old folk like me that need to actually understand that the norms have changed and that things like that are no longer acceptable. And I think some people do go, oh yeah, I hadn't thought about it. And I think you can really affect them, especially when you explain to them that what you're doing is protecting them as much as protecting the students, right? Because they're putting themselves in potentially dangerous situations where they could be accused of doing things that perhaps they didn't even intend to do, but people can still feel harassed by that. And I think there's a group of people that really don't understand that until you kind of point it out and walk them through that. And then I think that there are just a group of people who, feel like that's the politically correct police that come in. And I guess they're the ones that I worry that our online training, for example, won't be so effective with, because I think the group dynamic helped them to see that actually they're wrong. And I think that's what's so powerful about the groups. If I were to tell them that was the case, they would just think that I was being overly dramatic or something like that. So I think the group is really powerful in that sense. And I'm hoping that the way we've set up the online training, will work in that way. I think the only group that I really, worry about is that obviously there are some people who really don't care to do the right thing. And that's the group where it's very unlikely any sort of training, I think, or even whole of university approaches. The only thing that's going to work is when we change the culture so that other people call them out, right? That's the bottom line, I think.
Thank you so much, Louise, and thank you everyone for taking the time to share your experiences in this space. I'm sorry there are some questions there that we didn't actually get time for. My apologies. But to our presenters, we highly value and appreciate the work you've done and will continue to do to prevent gender-based violence in universities. Thank you so much. But before we wrap up quickly, we just ask you to take out your phones and scan this QR code to complete a really quick survey on today's session. Carmela will also drop the link into the chat as well. The survey is entirely voluntary, but your generous feedback is invaluable to help us understand the impact of our work and improve future sessions that we're delivering to you all. Carmela will also share the details of our data collection policy in the chat as well. A reminder to reach out to any of the numbers on your screen for support if you're feeling impacted by the discussions today. You can continue your learning by engaging with us further in the following ways. You can find out about our professional development opportunities in prevention and new resources by subscribing to our new universities mailing list by clicking on the link provided in the chat. You can also email universities@ourwatch.org.au. You can visit the Our Watch website, of course, to review our university-related frameworks, tools, and resources. And of course, you can follow Our Watch on all of the socials as well. Another massive thank you to our presenters today, Kellie, Louise, Jess, Sam, and Penny. You're all amazing. Audiences can reach out to them to find out more information if you need with those contact details that have been provided. Thank you, of course, to Our Watch and our digital support, Carmela. And thank you to all of you attending and sharing in this valuable conversation on the importance of integrating gender-sensitive and trauma-informed and inclusive approaches into university research environments. Thank you to Georgia as well for joining us too, and we hope to see you at our 5th and final webinar of our Educating for Equality domain series, which will have a focus on the governance, business and operations domain. Thank you again.